Hi everyone, Dinesh Sirisena here, and today we're going to be talking about injections to the metatarsophalangeal joint. As in my previous video about imaging the metatarsophalangeal joint, I usually recommend having the patient lying in a supine position with their foot planted on the examination couch. You can either have their knee bent or with a support beneath it, just to confer a bit more stability. This should be more comfortable for the patient and should make undertaking the injections a lot more straightforward. And this is how I would undertake the injection, either using an out-of-plane approach or an in-plane approach. And this is how I would do the out-of-plane approach. So having the transducer over the joint, I would bring the needle in as perpendicular as possible to the skin and as close as possible to the long border of the transducer. You should see the needle go directly down into the joint on the screen, and then once you're in, you can undertake the injection. With the in-plane approach, I would bring the needle from a proximal to distal orientation. I'd bring it to rest against the metatarsal head, so it's within the joint capsule, but not necessarily intra-articular. When you undertake the injection in this view, you should see the substrate flow into the joint from the joint capsule distally. And this is what you're hoping to see in both injections. In both, you want to see the joint beneath the transducer, and with the out-of-plane approach, as you bring the needle down into the joint, you may not see it in its entirety, but you should hopefully see the needle tip being guided into the joint space. With the in-plane approach, you want to see as much of the needle as possible, so you should see it beneath the transducer, and once it hits the metatarsal head, you can then undertake the injection and you should see the substrate flow into the joint. In both situations, it's useful to aspirate to make sure you haven't damaged any vessels before you undertake the injection. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram, and TikTok. And remember to check out sportsmedinfo.sg. Thanks again, and I'll see you all soon.